Hello everyone. Thank you very much for attending today and for giving me the opportunity to presentation. My name is Fuhua and I'm from the Division of Antioxidant Research at GIF University. I would now like to begin my presentation titled New Antioxidant Treatment for Depression. Depression and neuropsychiatric disorders is well known for its impact on cognitive function. It is also commonly associated with combined conditions such as diabetes mellitus, and these disorders, schizophrenia and Alzheimer's disease. Common symptoms of depression: difficulty getting out of the bed, difficulty in attending work or school, lower level of self-esteem, lower level of willingness to exert effort, energy, and concentration. Depression causes physical as well as mental symptoms, making social life difficult for the patients. Depression is often triggered by stress from environment changes, relationships, financial difficulties, or illness, making it anyone can develop. In particular, recent studies suggest that the environmental changes caused by the COVID-19 pandemic have worsened symptoms and led to the increase in the number of cases. Neuropsychiatric drugs are commonly used to treat depression, often in combinations. These medications are known to be highly addictive and difficult to abstain. In addition, side effects such as suicidal ideations have been reported. In the pathology of depression, changes in brain function, level of neuroplasticity, and the volume of the prefrontal cortex and the hippocampus have been observed. They are thought to result from increased production of reactive oxidative species and a decrease in antioxidant defenses. In addition, increased level of inflammatory cytokinase, decreased nerve growth factor, cellular aging, and excessive metabolic stress are thought to contribute to the onset of major depressive disorder. Mitochondrial dysfunction is also linked to depression. When mitochondrial function declines, it not only leads to cellular energy deficiency, but also disrupts communication between neurons and impair cellular resilience. This can potentially result in mood disorders and other psychiatric conditions. Reports on acute patients have shown decreased serum level of antioxidant, including reduced level to substances such as vitamin E, vitamin C, and CoQ10, as well as decreased antioxidant enzyme activity. Furthermore, increase in serum MDA and urearin 8-OHDG have been observed. Taken together, these findings indicated the oxidative stress is elevated in depression, which is strongly implicated in the pathology of the disorder. In depression, oxidative stress is believed to contribute to its onset, progression, and even recurrence. Therefore, antioxidant therapy could be a promising option for treating depression. However, treatments are research targeting oxidative stress in this area have not yet sufficient advances. Vitamin C is one of the antioxidants and is known to become deficient in stress-related disorders. It plays a role as a potential neuroprotective through its neuromodulatory and neurotropic effect. A study using mice reported that administering high dose of vitamin C IP for 3 days reduced brain acetylcholinesterase activity and improved memory. However, no improvement in physical symptoms was observed. Furthermore, high doses of vitamin C have been noticed to generate a subclavic radical NROS, raising concern about its potential effect. Twendee X is an antioxidant supplement composed of 8 ingredients. This supplement has undergone the safety testing required for pharmaceuticals and is patented. Twendee X contains vitamin C, and its antioxidant capacity was compared with that of an equal amount of vitamin C alone. The results clearly demonstrated that Twendee X, which contain other activity ingredients in addition to vitamin C, has significant higher antioxidant capacity than vitamin C alone. The protective effect of Twendee X on mitochondria was evaluated by ICTD, a French company that used cell line to assist ROS. In this experiment, the hepatic cancer cell line HepG2 was utilized. The result showed that Twendee X reduced both cellular and mitochondrial ROS levels, which increased superoxidative dismutase activity. Notably, mitochondrial SOD activity increased by 147%. Metabolic analysis of HepG2 cell treated when Twendee X was conducted. After 1 hour of incubation with Twendee X, significant changes in metabolism were observed. Notably, both mitochondrial metabolism and energy production were increased. Their results suggest that Twendee X has the potential to inhibit the decline in mitochondrial function associated with depression. Removing free radicals thought antioxidant is often challenging. Free radicals are generated from familiar sources in our environment, such as tobacco smoke, ultraviolet light, and radiation. Additionally, their primary product is mitochondria within the body. However, healthy mitochondria typically don't leak free radical into surrounding environment. Because free radical can potentially damage DNA and protein, it is essential to suppress their accumulation. Twendee X effective scavenges common free radical, including methyl radical, hydroxyl radicals, and superoxide radicals, while high dose of vitamin C can lead to formation of ascorbic radicals. No such occurrence have been observed with Twendee X. Despite it being a vitamin-containing supplement, therefore consuming high dose of Twendee X does not pose a risk of radical formation. We have also examined the effect of Twendee X on the microbiota. The gut microbiota responsible for produce short-chain fatty acid, which include butyric acid and propionic acid. Butyric acid exhibit anti-inflammatory properties, while propionic acid is involved in nerve inflammation. Our results show that the consumption of Twendee X leads to an increase in butyric-producing bacteria and a decrease in proportionally producing bacteria. Additionally, butyric-produced bacteria are known to be prevented in the intestinal of long-lived Japanese individuals, and their increase was also observed following Twendee X intake. Elevated level of inflammation are considered a significant factor in the symptom of depression. Therefore, the increase in butyric-producing bacteria may play an important role in alleviating depressive symptoms through their anti-inflammatory effect. Administration of Twendee X in mouse stroke model reduced oxidative stress and inflammation in the brain 5 days after infarction. This led to reduction of the infarct area by 2/3. In Alzheimer's disease mouse model, administration of Twendee X reduced inflammation, oxidative stress, and amyloid beta protein level in the brain. This finding indicated that Twendee X effectively inhibit inflammation and oxidative stress in the brain. 4 years ago, the effect of Twendee X on mild cognitive impairment was published in the Journal of Alzheimer's Disease. Twendee X demonstrated a significant improvement in cognitive function score in Japanese patients with mild cognitive impairment, as measured by the MMSE and the HDSR, the reverse Hasegawa's dementia score. The next section is about Twendee mitochondrial. Twendee mitochondrial is an antioxidant supplement that combines 7 additional ingredients with Twendee X. It has pass safety test equal to the required for pharmaceuticals. The addition of this ingredient has been shown to enhance its antioxidant capacity, making it more potent than Twendee X. CFS is a condition characterized by prolonged fatigue and malaise with no identifiable cause. In addition to fatigue and malaise, it may be accompanied by symptoms such as weakness, muscle pain, low-grade fever, headache, cognitive dysfunction, sleep disorder, and reduced memory and concentration. Many of these symptoms overlap with loss of expression. I will introduce the survey result, focusing on the symptoms that are common between CFS and depression. The impact of CFS on daily life is considered to be quite substantial, and in fact, over 95% of the patients reported being affected by it. However, after taking Twendee mitochondrial, this procedure decreases. Notably, before taking Twendee mitochondrial, None of the patients reported being unfair in their daily lives, but after taking the supplement, some participants reported no longer experiencing any impact on their daily activity. In the survey of fatigue, over 80% of participants reported being significantly affected in their daily lives before taking 20-minute control, with none reported no impact at all. However, after taking 20-minute control, nearly 10% participants reported no fatigue impact in their daily lives, indicating a remarkable improvement. As clearly shown in the peers chart before taking 20-minute control, sleep disorder was the factor that most significantly affected daily life for all participants. Sleep disorder also a key symptom in individuals with depression. Before taking the supplement, none of the participants reported feeling no impact on their daily life, but after taking it, around 20% of participants reported no impact for sleep disorders. This result indicates a significant improvement in sleep quality. Memory and concentration problems are also significant symptoms in individuals with depression. Before taking 20-minute control, more than 85% participants reported a substance impact on their daily lives. However, after taking the supplement, the percentage of those who felt attacked most by memory and concentration issues dropped from 5% to 0%, indicating a marked improvement. Depression is a complex condition involving multiple factors. Even with antioxidant properties, a single ingredient appears to have only a limited impact. Since Twendee X demonstrates a strong antioxidant effect, increased SOD level, enhanced energy production, and positive influence the gut microbiota, it is suggested to improve various symptoms. This may be attributed to the well-balanced blend of 8 ingredients in Twendee X. Based on the result of these studies, Twendee X may offer a promising antioxidant approach for the novel treatment of depression. Thank you for your attention.
Thank you very much for the presentation. Any comment or questions? Yes, please. Yeah, yes.
Okay, Domo. This was a nice talk, and the improvement parameters you have shown to us also indicate usually improvement with skin irritation, acne and stuff. Have you observed this within the groups you investigated?
Skin irritations. Actually, we have an experience of the questionnaire monitoring on atopic dermatitis, and then 80% of patients improved the symptoms. Is that okay? Yes, please. Yes, please.
Given that you have effects on the central nervous system, which of the molecules in this cocktail actually penetrate the blood-brain barrier? Which get into the blood-brain barrier, across the blood-brain barrier, into the central nervous system, and are have the related effects?
Actually, the ingredient would be through BBB, is except coenzyme Q10, because the coenzyme Q10 is a large molecule, and the vitamin C and then the small protein is easy to penetrate. But the most important thing is blood oxidative stress dramatically reduced, automatically brain inflammation reducing. Is that okay? Oh, yes, please.
Where is product available for sale?
In the United States, you can buy Amazon. In Europe, 2 ingredients, malic acid and succinic acid, is not allowed to sell as a supplement. So we are planning to that 2 ingredients substrated Twendee X nearly soon. And also in Japan, you can order by internet. Okay, so I would like to, thank you.